In 1981, just a few years after the declaration of Alma Ata, the World Council of Churches decided to act on the need for access to essential medicines in developing countries. The Christian Medical Commission of the WCC set up a pharmaceutical program to function as an advisory unit to assist church health programs in management and rational use of medicines. In the year 2000, the program evolved into the Ecumenical Pharmaceutical Network, now an international network of Christian health associations, church health institutions, faith-based pharmaceutical supply organizations, NGOs, and individuals working to ensure that pharmaceutical services are just compassionate and of good quality. EPN is a true platform for sharing, learning, and growing. It is estimated that up to 40% of health services in parts of Africa are provided by churches. For 30 years, EPN has been their voice on pharmaceutical issues, making the work they do known and supporting them in the implementation of pharmaceutical programs. In line with its mission to support church health systems, EPN provides tools, guidelines, capacity building workshops, and other technical assistance to church health programs and church health facilities. First in Geneva, then in Nairobi, hosted by Community Initiative Support Services for several years, and briefly also with a liaison office in Burkina Faso, the pharmaceutical program and the network that was born out of it have adopted and changed. But from the beginning, increasing access to healthcare and medicines, especially for the poor, vulnerable, and disadvantaged, has been one of the main objectives. Because every human being is made in the image of God and has a right to a full and healthy life. The multi-country study on medicine supplied by 16 FBOs, done in collaboration with the World Health Organization in 2003, showed that those faith-based pharmaceutical supply organizations serve between 25 and 60% of the population in 10 African countries, proving that they make an invaluable contribution in guaranteeing the availability of medicines. For this reason, EPN support to these institutions remains important, so that good, quality, and affordable essential medicines can be available wherever they are needed, from the national level depot to the remotest dispensary. EPN's guidelines for effective and efficient pharmaceutical services developed through years of consultation and field testing support health facility managers, pharmaceutical personnel, and all those involved in pharmaceutical service delivery to assure a high level of services and access to medicines. Improving and advocating for rational use of medicines by prescribers, pharmacy staff, caregivers, and patients is crucial not only for the sake of getting the most effective treatment at the lowest possible price, but also to counter the development of antimicrobial resistance, which is a threat to the health of generations to come. All this is done through capacity building, information sharing, and community action, engaging church health programs, health institutions, and health professionals as well as patients. Another area where communities and especially church leaders are important is HIV and AIDS treatment. With lessons from the EPN Treatment Literacy Guide and the workshops run in numerous countries, church leaders can be a strong influence, reducing the stigma surrounding the disease and encouraging those affected in their congregation to seek treatment and stay on treatment. Pharmaceutical human resource mapping studies conducted in over 250 hospitals in 7 countries revealed that only 25% of church hospitals employ a pharmacist. And therefore, in spite of the need for continuing education for pharmacy professionals, it's back to basics with the development of a curriculum for a 3-month course on essentials of pharmacy practice. Knowing that knowledge is power, EPN has also been sharing information on pharmaceutical issues for many years. Through the work of EPN, pharmacy staff, prescribers, procurement managers, health facility managers, directors, and other professionals have learned what it takes to improve their services. Patients and caregivers have not been left behind either. gains have been made in reducing the stigma around HIV, more patients have access to both basic and life-saving treatments. Health institutions have been empowered to increase efficiency, reduce cost, and transfer these benefits to their patients. The work is not done, but it is on track. At all the stages of its life cycle, in whatever form it has been, EPN's work has been done by its members and staff, combining a rich field knowledge with strong programmatic insights, guided by a vision of a better world and the strength to keep on building it, confident that EPN's vision of just and compassionate quality pharmaceutical services for all will one day be a reality.